Kathy Olewski, the host for the Vasculitis Foundation Educational Webinar Series. I'm also a patient living with MPA vasculitis. So this webinar is one in a series of short interviews with doctors who attended the 2023 American College of Rheumatology Convergence. Today we have with us Dr. Sebastian Sattui. And Dr. Sattui is an assistant professor of medicine at the University of Pittsburgh and director of the University of Pittsburgh Medical Center's Vasculitis Center. So welcome, Dr. Sattui. We really appreciate having you for your time here today to answer some questions for us.
No, thank you so much for the invitation, especially timing this at least a week after ACR, because I think it is a very exciting meeting for all of us, but there's so much to digest as well. I guess as brief disclosures, I do have to mention that I have some personal funding from the Bristol Myers Squibb Foundation for a Career Development Award. I participate in clinical trials with GSK, and I have participated in other trials with AstraZeneca as well. And I have provided both consulting for Sanofi and an advisory board for Sanofi, as well as advisory boards for Amgen, which are all relevant potentially or directly or indirectly to some of the things that we will mention about exciting happenings at ACR. So I think as a kind of brief takeaways from ACR, from the vasculitis lens, which is usually kind of the lens that I have on when I go to this meeting. It was a fantastic meeting. I think there's a lot of things that happen at ACR. There's, for us who, this being our second kind of post-pandemic in person, there's a lot of, particularly what we need, collaboration, networking, kind of getting people in the field, getting the ideas together, discussing kind of how to take our field forwards, how to advance the care for our patients is crucial for all of this to tend to happen in person. As a first take, I think we're talking about briefly, so the ACR usually has this plenary sessions where like the 15 top scoring abstracts are actually selected to be presented in 3 different sessions throughout the meeting. It's one of the sessions in the big hall a day, and I was happy to see that there were at least one vasculitis talk on every single one of these sessions, going from the real world data from the French vasculitis study group using kind of with regards to steroid dosing and the Pexivas low dose steroid dosing, as well as the incidence of opportunistic infections in patients with ANCA vasculitis as well, and the benefits from using thermetropin. The one that caught the most my attention, given the numbers on this and kind of I think the importance of this topic, was regarding pregnancy outcomes among patients with vasculitis. And this was a study from the Stanford group led by Audra Horomansky that actually, and presented by her, that used data from large claims data. So, this is big data, especially which is important and relevant for when we're talking about rare diseases. So this study that went from 2007 to 2001 kind of identified over 600 pregnancies of women living with vasculitis, identifying specific risk factors, identifying a specific kind of a higher risk of either spontaneous abortions or preterm delivery in patients who living with vasculitis when pregnant. So this data is important for us to, again, keep knowing what the risks are in order to actually be able to minimize them. And the value, as much as claims data does not give you very specific granular data like, disease activity, there's some limitations to that, but it allows you to, again, with such a rare occurrence in people who live with rare diseases, better understand what the risk factors are in order to better kind of provide care and kind of plan care going forward for that, which is very important in the kind of the planning of pregnancies for women who live with vasculitis. So that was one big kind of take. The second big take is talking about other big sessions in the ACR. The ACR usually has a session that's called the Great Debate, which is actually 2 kind of leading experts on the field who are have to debate again is on a specific topic. And this topic's debate, which I actually moderated this session, and the main along with Dr. Carol Langford from the Cleveland Clinic. The two speakers invited were Dr. Robert Spira from the Hospital for Special Surgery and Dr. Philip Seo from Johns Hopkins. And the topic was about starting advanced therapies early at the onset, early in the treatment of patients with giant cell arteritis and PMR. So we have this debate. Of course, these are conditions that historically have been treated with glucocorticoids, but now both for GCA and now for PMR, we have approved steroid-sparing agents for this, particularly IL-6 inhibitors. So the debate was whether there is data enough for us to say that this medications need to be started early on or later. And I think both speakers actually gave very good points, keeping the debate lively and trying to stick to what they have been, the positions that they have been assigned. And at the same time, I think highlighted a lot of the benefits and the compared to years before where we are now, where we actually do have effective steroid-sparing agents that work, that allows to minimize glucocorticoids and associated damage in our patients, but at the same time highlighted a lot of the questions that we still need to ask and that we still need to answer with research now that these medications are on the field and are we using them on a daily basis to treat our patients. So again, another great example of vasculitis taking the big stage, which was fantastic. Other studies that were presented, there was a specifically, use of avacopan is certainly, a focus of everyone's attention at this point, given that not only we learned what we learned from the trial, the advocate trial that led to the approval of avacopan for the treatment of GPA and MPA, but how is it being used in the real world, and how is it actually impacting the care of people living with GPA and MPA? So there were several different abstracts kind of talking about the real world experience with it. A couple of them, one from the MGB, so Mass General Brigham Center, and another one which was a multi-center retrospective study that I presented on behalf of a bunch of different co-authors from different centers in the US, talking about, again, the benefits that we're seeing on the medication, some variability that we're seeing regarding its use as well, but overall quite in line with the efficacy and the benefits that we're seeing on the trial, but certainly with some variability on its implementation and use, as well as sometimes delay in initiation, which is something that we hope to see a continued improvement into access for the medication. So those are another kind of thing. The Mandara trial was presented as well. Again, it's another the data of another IL-5 inhibitor for the treatment of patients with GPA. So another hopefully soon to be option in the care of our patients with GPA. So other exciting stuff. And then one of my favorite sessions as well, which I don't think we talk about enough, there was a session about IgA vasculitis and IgA nephritis, which was fantastic. Was a couple of great talks. One from Matthew Coster from the Mayo Clinic, another one from David Jane and Cambridge in the UK. Which we all know, we all see, we're all aware of sometimes the challenges of treating this patient. So it was a fantastic talk by two kind of, knowledgeable and experts in the field, as well as highlighting where two things need to go next in order to continue to advance the care of our patients. So those were at least some of the sessions. And again, the big stamp of vasculitis in the meeting that I would remember, I kind of come to mind. Always as well, which I don't know how many patients are usually aware of this, but before the ACR meeting, there's always a vasculitis investigator meeting, right? The day before the whole official festivities of the ACRs tend to happen. And this is a meeting of vasculitis investigators from the world. So Asia, South America, North America, Europe, Australasia. So it's fantastic. It's actually a good way, although a busy meeting, run particularly by Dr. Merkel, the VCRC, and the BPRN staff, as well as some of the European groups. But it's a great kind of highlight of all the different investigations that are going on right now, the different trials, the opportunities for collaboration to keep advancing the knowledge and improving the care of our patients. So I think nothing to necessarily get too much into it, but just like this is something that happens every day. And I think for a vasculitis investigator, it's refreshing and certainly gives a lot of excitement of all the things that are going on that will continue to go on forward as well. So that, I don't know if at least I covered a lot of those my main highlights from the meeting.
Yes, that was great. And you mentioned the VPPRN, and I don't know that everybody knows that that is the Vasculitis Patient-Powered Research Network. So it's about patients. And speaking of patients, did you have a feel for a growing perspective of patients in the ACR annual meeting?
Yes. So first, talking a little bit about the BPPRN. So for those of who are listening or not aware, the Vasculitis Patient Power Research Network is a fantastic kind of online platform for patients to contribute to research and be involved in research actively. I'm biased because I'm one of the BPPRN investigators, and there were, if I recall correctly, 4 different BPPRN posters or abstracts that were submitted in the meeting, going from different topics, including sleep to frailty and the VAST-STRONG study, which is the study where I'm the PI as well. So that is, again, it's important to mention because this is actually research that is specifically fueled by patients, addressing patients' concerns, and with patients in the front driver's seat as well, which is always exciting. What I was, I guess, mentioning as well is that I think one thing that to me is encouraging, as much as I know always that the Vasculitis Foundation stand will be there within the exhibitors, is that the presence of patients in the ACR, not only in the exhibit halls, but also in the actual scientific meeting, continues to grow, which I think it's exciting. It's needs to keep growing. There's now in the poster hall a patient kind of experience abstracts and posters, which is fantastic. There were several of the scientific sessions that included patients as well as speakers, and a lot of sessions that were actually proposed by patients as well. I think this is something that I've seen being, picking up in the last few years, and I just hope it continues to grow, because as we are all aware, it's the collaboration and the teamwork between rheumatologists but also patients who actually kind of lead the field forward and the care of everyone forward. So I think I acknowledge that the ACR is doing this, and I applaud them for that, and I hope it just continues to grow in the next few years as well.
As a patient, I just want to say one of my takeaways from your takeaways is that the ACR seems to be, for those of us that didn't know, all about rheumatologists looking forward, working forward, doctors learning from other doctors. That's pretty much what you're saying. Is the field of rheumatology going strong? Are there challenges, sort of behind the scenes in the field of rheumatology?
I think we are all aware that there are some issues and concerns about the rheumatology workforce going forward. I think this is something that everyone is reflected and understanding kind of the waiting times that some new patients experience when trying to see a rheumatologist. The field is, I think for that, the college and the Rheumatology Research Foundation that are associated are actually taking a strong stance in order to try to prevent this, understanding that this is not an issue only for us physicians, but also for our patients, which is the reason why we, get trained and go to clinic every day or do research for sure. So there are a lot of, fortunately, I think given these predictions, and this all come from actually a study that was done a few years back, predicting these issues with the potential shortage in the workforce, that the ACR and the RRF have, which is the Rheumatology Research Foundation, have actually started a lot of programs that are under the umbrella of Choose Rheumatology, which are basically programs that secure funding and exposure to people who might be interested in rheumatology at different phases of their professional careers. So this starts from, one would expect, this is like rheumatology fellows getting funded in order to go to the ACR, but this actually goes to residents, goes to pre-med students, goes to other undergrad students as well, and even college, because the fact is that the idea is to highlight how exciting the field is, actually secure the opportunity for as someone who goes there and enjoys ACR and then feels the excitement of our field. I think it's to actually showcase that to people who are still not in the field, and we can actually show them that both the excitement and certainly the need for for our field to continue growing, to secure a workforce and to secure the care for our patients. So this is something that continues to grow. There's, again, part of this program is focused around helping supporting people to go to the meeting, present their work, get involved, find mentors, network. But there's also a lot of other programs that are around expansion of that are from the college and the Rheumatology Research Foundation for expansion of the workforce as well, that are focused around expanding fellowship programs, supporting new fellowship programs as well. So it is a concern that we all have, and certainly the college has, but it's something that they clearly are acting upon at all different levels to try and, again, to secure an adequate workforce to take care of our patients.
That's actually pretty exciting news. I hope a lot of people see this and get that message so that they'll move into that field. I have one last question, just because it's on the topic of everybody right now. All of us vasculitis patients are always looking for the future. So CAR T cell therapy, any thoughts on that?
Yes, I know the excitement about this, and I think that every time, actually, after I came back from one of my patients sent me a message and say, I know you were at the ACR. They were discussing this in the blogs. Have you guys found a cure yet? And I think there's where a lot of the hype and the excitement around CAR T cell therapy are, which I think, again, this is a field that this is a part of the field that's starting. So I think there's still a long road ahead. Most of the studies that we've seen, although of course there's a few kind of case reports regarding ACR vasculitis, but a lot of the abstracts that I've seen presented or sessions that I've seen presented were mostly focus on other conditions like lupus or myositis. Certainly there was a large session in CAR T cell therapy, which, if I recall, there was also a conversation about its role in ACR vasculitis, which is within the primary systemic vasculitides, the one where it's being discussed the most. It is exciting. I think we still have a lot to learn. The potential of being able to treat our patients to get, I'm not sure if the cure, but close to it, is something that is exciting for all of us. But I think we still need to learn a lot about it. It's a very growing field, growing technology, rapidly advancing, where a lot of investigators, a lot of companies are having an increased interest. So I think the interest that patients have in it is clearly is fueling a lot of investigators in the field. But hopefully we'll continue to learn more.
Well, thank you, because the patients are talking about it. So we appreciate you elaborating on it a little bit. And thank you so much for spending your time with us, Dr. Sattui.
Well, it's always a pleasure to talk and again, talk vasculitis. And next year, we actually have the Vasculitis International Workshop as well in Barcelona. So that's a meeting only on vasculitis. So I think a lot of takeaways as well and exciting information will come from that.